You might think your shortness of breath, swollen ankles, or afternoon fatigue are just getting older. But what if your heart is quietly asking for help, and you've been missing its earliest whispers? I'm Dr. Hartley, and after 25 years working with seniors, I've seen how these tiny signs, often ignored for months, can predict heart failure long before crisis strikes. Keep watching, because one of these 13 clues may already be showing up in your daily life. And catching it early could change your future. Many of my senior patients told me, "Doc, I thought it was just aging." That belief delays diagnosis by 6 to 12 months, precisely when early care makes the biggest difference. Recent studies show that recognizing subtle changes in energy, breathing, or swelling can improve outcomes by up to 87%. So, today we'll walk through 13 everyday signs your heart may be struggling, and how to tell the difference between normal aging and something deeper. Remember, this information is for education only. Always talk with your healthcare provider about your own symptoms. 1. Unusual fatigue that rest doesn't fix. You wake up tired, you rest, but your body still feels like it's walking uphill. Many seniors tell me, "Doc, I just don't have the energy I used to." What most don't realize is that this isn't about age, it's about energy supply. Inside every heartbeat are thousands of tiny power stations called mitochondria. These generate the energy that keeps your heart pumping 100,000 times a day. But after 60, these mitochondria begin to break down, like an old car engine losing horsepower. When they fail, your heart muscle can't make enough energy, and fatigue sets in, no matter how much you rest. In a 2020 study tracking nearly 6,000 seniors, researchers found that those with elevated NT-proBNP, a blood marker of heart strain, had up to a tenfold higher risk of fatigue-linked heart failure. What this tells us is that tiredness after rest isn't laziness. It's often the first whisper from your heart that its fuel system is running low. In my 25 years of clinical practice, I've seen how simple daily tracking can make all the difference. If your usual walk around the block suddenly feels harder, or if grocery bags feel heavier than they used to, that's your early signal. Think of your heart like a generator. It's not broken, it's just running on half charge. Here's a gentle habit I recommend. Keep a short energy diary. Note how you feel in the morning, after lunch, and before bed. If fatigue grows even when you're well rested, it's time for a checkup, not more caffeine. But here's what most people miss. This early fatigue often shows up months before swelling or shortness of breath ever appear. And the next sign, what happens when you lie flat in bed, can reveal even more about how your heart is coping. 2. Shortness of breath when lying flat. It's one of those quiet moments at night. You settle into bed, and suddenly you can't quite catch your breath. You shift your pillows higher, maybe even sleep half upright. Many seniors shrug this off as just getting older, but what's really happening is far more revealing. When your heart's left side weakens, it can't pump blood forward efficiently. Fluid begins to back up into your lungs, almost like a sponge soaking past capacity. Lying flat lets that fluid spread, pressing gently but persistently against your airways. You feel it as breathlessness, or that need for an extra pillow. A 21-year follow-up from the cardiovascular health study found that seniors reporting nighttime shortness of breath were twice as likely to develop heart failure within 5 years. The lungs, in a sense, become the overflow warning light for the heart. In my clinic, I have worked with many patients who thought it was asthma or just poor sleep. What I found was that simple observation, like noting how many pillows you need to rest comfortably, can help doctors spot heart strain early. If you suddenly go from 1 pillow to 3, your body may be compensating for pressure in the lungs. Try this quiet self-check. When you lie down, notice if your breathing feels easier after sitting up. If it does, mention it to your healthcare provider. It's a small clue, but it can save months of misdiagnosis. Remember, your lungs aren't the problem, they're the messenger. They're telling you the heart's pump is working overtime. And yet, even before breathlessness, another silent clue may show up right at your feet. It's one that seniors often mistake for too much salt or a long day. But as you'll see next, swollen ankles can speak volumes about what's happening inside your heart. 3. Swelling in ankles or feet. For many seniors, it starts quietly, a bit of puffiness around the ankles at night, shoes feeling snug, or socks leaving deep marks on the skin. Most think it's just water weight, but swelling in the lower legs can be the heart's way of whispering, "I'm struggling to keep up." When the heart weakens, it pumps blood less efficiently. The kidneys sense this drop in circulation and activate a system called the renin-angiotensin pathway, which tries to hold onto salt and water to raise blood pressure. But in older adults, this system often overreacts, causing fluid to pool in the legs and feet, what doctors call edema. Imagine your body as a city with a traffic jam. The streets are your veins, and when the heart pump slows, traffic backs up, especially in the lowest parts of the body. The result? Swelling that lingers or worsens through the day. The cardiovascular health study found that seniors who developed new leg swelling had a 22% higher risk of future heart failure within 2 years. In my own clinic, I've seen this countless times. Patients blaming hot weather or long walks, when the real issue was fluid buildup from a tired heart. Here's a practical tip. Each evening, press gently on your shin or ankle for 10 seconds. If a dent remains, it's worth mentioning to your doctor. Track it in a small notebook. Patterns matter more than single days. One of my longtime patients, Harold, once told me, "I thought my socks were shrinking. After evaluation, we caught early heart strain before it progressed. So if your ankles are quietly swelling, listen closely. Your body may be trying to protect you from something deeper. But the next sign doesn't show in your legs. It shows on the scale, sometimes overnight. And the number it reveals can be the most urgent clue of all. 4. Rapid weight gain in days. Imagine stepping on the scale and seeing you've gained 3 pounds since yesterday. You haven't eaten more, your clothes fit the same, yet the number keeps climbing. For seniors, that kind of sudden weight change often has nothing to do with fat. It's fluid, and it's one of the clearest early signs your heart may be struggling. When your heart weakens, the body compensates by retaining water. It's an emergency backup plan meant to keep blood pressure stable. But when that plan runs too long, excess fluid seeps into tissues, joints, and even the lungs. Think of it like a sponge that's been soaked past its limit. No matter how carefully you squeeze, it can't release enough. Research published in Diagnostic Accuracy in Seniors, 2024, showed that a weight gain of just 3 pounds in 2 days predicted early fluid overload with nearly 90% accuracy when combined with blood marker testing like NT-proBNP. That's why cardiologists often tell patients, weigh yourself at the same time every morning. In my clinic, I've seen early intervention turn this around quickly. One patient, Evelyn, began tracking her morning weight after we talked. When her numbers jumped 5 pounds in a week, she called her doctor and caught early heart failure before hospitalization was needed. Here's your simple protocol. Weigh yourself after using the restroom before breakfast, at the same time, daily. Write it down. If the number rises more than 3 pounds in 2 days or 5 in a week, that's your cue to call your healthcare provider, because what looks like just water may actually be your heart asking for help. And sometimes that extra fluid doesn't just change your scale, it changes how you sleep. In the next segment, we'll look at what happens when shortness of breath wakes you up in the middle of the night, and why that moment matters more than you think. 5. Waking up. Short of breath at night. You're sound asleep, and suddenly you wake up gasping, sitting upright just to breathe. The room feels heavy. and you wonder if it's a bad dream, a panic attack, or maybe just indigestion. But what's really happening is something much deeper inside the chest. When the heart's pumping ability declines, fluid that builds up during the day redistributes at night. As you lie flat, gravity no longer keeps it in your legs. It moves upward into the lungs. That sudden shift can cause what doctors call paroxysmal nocturnal dyspnea, shortness of breath that wakes you up from sleep. A 2024 study in Frontiers in Cardiovascular Medicine found that seniors with this symptom were 3 times more likely to have early-stage heart failure than those without it. It's one of the strongest nighttime warning signs that the heart is under strain, even before more visible symptoms appear. In my 25 years of practice, I've seen this pattern again and again. One of my patients, Martha, used to keep an extra pillow behind her back. "It's the only way I can sleep without that choking feeling," she told me. Once her fluid balance was corrected through gentle medication and daily tracking, she said it felt like breathing came back. If you ever find yourself waking up breathless, don't ignore it. Note how often it happens and whether sitting up helps. That detail helps your doctor understand how your heart is managing nighttime fluid shifts. And here's something few realize. This fluid doesn't just stay in your lungs. Over time, it triggers a silent inflammation fire throughout the body, one that keeps the heart struggling day and night. In a moment, I'll show you how that inflammation can reveal itself through a symptom many confuse with allergies or a lingering cold. 6. Persistent cough or wheeze. A nagging cough that won't quit, a wheeze when you climb stairs. For many seniors, it's blamed on allergies, old smoking habits, or even just the weather. But sometimes that cough isn't from your lungs at all. It's your heart's quiet SOS. When the heart can't push blood forward efficiently, fluid begins to back up into the lungs' small air sacs. Those tiny sacs fill, irritating nearby nerves and triggering a cough that often worsens when you lie down. It's the body's attempt to clear the overflow that shouldn't be there in the first place. In 2023, the Medina Cardiac Center study measured inflammatory markers in seniors with early heart failure. They found IL-6 levels more than 5 times higher than in healthy adults. That means inflammation itself was fueling the cough, an internal fire scientists now call inflammaging. In my clinical experience, when I hear a senior describe a dry, tickling cough that appears mostly at night, I don't reach for a cough syrup. I ask about swelling, fatigue, and breathing changes. Because when the heart is the culprit, treating the lungs alone never works. Here's a simple self-check. Notice if your cough worsens when you lie flat, or improves when you sit upright. Does it feel deeper in the chest than in your throat? If so, it may be time to ask for a heart evaluation instead of another round of allergy medicine. One of my patients, Leon, once said, "It's just a little cough." Within weeks, his ankles swelled, confirming what the cough had been warning all along. But that same congestion that irritates the lungs also affects digestion. When blood flow shifts away from the stomach, the body sends yet another subtle message, this time through appetite loss and nausea. 7. Loss of appetite or nausea. You sit down for dinner, but food just doesn't appeal. You feel full after a few bites, or even queasy. Many of my older patients say, "Doc, I just don't have the same appetite anymore." What most don't realize is that the issue isn't in the stomach, it's in the circulation feeding it. When the heart's pumping strength weakens, it naturally prioritizes vital organs like the brain and lungs. The digestive tract, being lower priority, receives less blood flow. Picture a garden hose with weaker water pressure. The farthest plants start to wilt first. That's exactly what happens to your gut when cardiac output drops. This reduced blood flow slows digestion and can cause nausea, bloating, or even mild abdominal pain after meals. A 2024 review in PMC 9803556 found that nearly half of seniors with early-stage heart failure reported appetite changes months before diagnosis. In my clinic, I've often seen this sign appear in patients who also describe a tight belt feeling or early satiety. One woman, Doris, told me, "It felt like my stomach stopped working." Once her heart function improved, her appetite returned within weeks. If you find yourself skipping meals or feeling nauseated without clear cause, take note of timing. Does it worsen after activity? Is it paired with swelling or shortness of breath? These clues help your doctor spot heart-related digestive changes before they advance. A simple, heart-friendly approach, I suggest. Smaller, balanced meals spaced throughout the day, with mild movement afterward to support circulation. Avoid heavy dinners late at night, when your heart is already working hardest to manage fluid shifts. But sometimes that same sluggish circulation doesn't just affect digestion. It begins to back up further into the abdomen itself, causing visible bloating that's easy to overlook but deeply telling. 8. Swelling in the abdomen, ascites. Have you noticed your waistband feeling tighter even when your weight hasn't changed? Or perhaps a slow, firm swelling in your belly that doesn't seem to go away? For many seniors, that bloating isn't from food. It's from fluid buildup in the abdomen, a sign your heart's right side may be under stress. When the right ventricle weakens, blood returning from the body can't move forward efficiently. Pressure builds in the veins that drain the liver and digestive organs. Gradually, that excess fluid leaks into the abdominal cavity, creating what doctors call ascites. It's like a dam holding back water. Eventually, the pressure finds another path. A 2015 paper in Revista Española de Cardiología reported that abdominal swelling in older adults often preceded visible leg edema by several weeks, acting as an early marker of right-sided heart strain. Many seniors dismiss it as gas or weight gain, losing valuable time for early intervention. In my clinical practice, I've seen this pattern too often. One patient, Ben, thought his belly growth was from a few too many snacks. When we checked his blood tests, his liver enzymes were slightly elevated, a reflection of venous congestion, not overeating. Here's a gentle self-check. Press the side of your abdomen with your fingertips. If it feels unusually firm or heavy, and you've noticed swelling in your ankles too, bring it up at your next appointment. Sometimes your stomach isn't full of food. It's full of the effort your heart is making. The good news? With early medical care, including gentle diuretic adjustments and salt moderation, ascites can often improve quickly. But when the body's circulation struggles this way, it doesn't only affect your gut, it can also starve your brain of oxygen-rich blood, leading to a symptom most people never connect to the heart at all: confusion and brain fog. 9. Confusion or brain fog. You walk into a room and forget why. You reread the same line 3 times. Or you feel like your thoughts are wrapped in cotton. Most people blame memory loss on just getting older. But what I've seen time and again is that the brain's fog often begins with the heart's slowdown. Your brain needs a constant flow of oxygen-rich blood, delivered through a network of delicate vessels. When the heart's output drops, even slightly, that supply falters. It's like a lamp flickering because the current is weak, not out, but inconsistent. Over time, the brain receives less oxygen, leading to fatigue, slowed recall, and trouble concentrating. A 2024 paper in Frontiers in Immunology found that up to 55% of seniors with mild heart failure experience cognitive changes, even before other symptoms appear. Inflammation and reduced cerebral perfusion, less blood flow to the brain, were the key links. In my 25 years of clinical practice, I've met many seniors who said, "I thought I was developing dementia." But once their heart function was supported through medications, gentle walking, and fluid control, their clarity returned. One patient, Edna, described it perfectly. "It felt like my brain finally got fresh air again." Here's a simple check I often recommend. If your mind feels cloudy on days when your ankles are swollen or your energy is low, that's not coincidence, it's connection. The same circulation that powers your legs also feeds your mind. Supporting brain oxygen starts with supporting heart rhythm, regular movement, hydration balance, and proper sleep positioning. But as night falls, another clue often appears: frequent trips to the bathroom. Many seniors think it's just aging, but it's your kidneys working overtime to balance what the heart can't. 10. Nighttime urination increase, nocturia. It's 2 a.m., then 4 a.m., another trip to the bathroom. Many older adults accept this as just how aging works. But if you're up several times a night, the reason may not be your bladder at all. It might be your heart's way of draining itself. During the day, gravity keeps extra fluid in your legs and feet, but when you lie down at night, that fluid finally returns to your bloodstream. The kidneys, now sensing the overload, work hard to remove it, sending you to the bathroom again and again. It's not random. It's a natural drainage system trying to balance what the heart can't handle on its own. A 2024 report in Lids and Geriatrics showed that over 60% of seniors with early heart failure experienced increased nighttime urination long before diagnosis. This pattern, daytime swelling, nighttime bathroom trips, is one of the most consistent early combinations I see in my clinic. In my 25 years of practice, I've learned to ask, do your legs feel lighter in the morning? When patients say yes, that's a telltale sign the heart is working overtime while they sleep. Here's a gentle home check. Elevate your legs for 30 minutes in the evening. If that reduces nighttime trips, it suggests your body is redistributing fluid. Also, try limiting salt after dinner and talk with your doctor about the timing of water pills. Sometimes adjusting them to earlier in the day makes a world of difference. Remember, this isn't about embarrassment, it's about awareness. Your kidneys are simply doing the cleanup shift for your heart. And yet, as the body fights to stabilize itself, it often reveals another hidden clue: an irregular heartbeat or fluttering sensation in the chest that can appear suddenly, then vanish before you can describe it. 11. Irregular heartbeat or palpitations. You're sitting quietly, reading or watching TV, when suddenly you feel it: a flutter, a skipped beat, or a strong thump in your chest. It passes in seconds, so you shrug it off. But those fleeting moments can carry an important message from your heart's electrical system. Your heartbeat depends on a finely tuned rhythm, powered by calcium and potassium moving in and out of cells. With age, these mineral gates can get sticky, and the heart's electrical signals misfire. Combine that with an overactive sympathetic nervous system, the body's stress accelerator, and your heart may start racing or skipping beats for no clear reason. A 2020 Journal of the American College of Cardiology report found that seniors with these irregular rhythms had a 39% higher risk of developing full heart failure within a year. Often the culprit wasn't stress. It was structural strain the patient couldn't yet feel. In my clinic, I've seen how simple awareness can change everything. One patient, Linda, used her smartwatch to track her pulse after noticing weird flutters. Those records led to an early diagnosis of atrial fibrillation and treatment that prevented hospitalization. Here's a practical step. If you ever feel fluttering, dizziness, or a sudden strong heartbeat, sit quietly and check your pulse. If it feels uneven or unusually fast, especially if paired with fatigue or shortness of breath, note the time and activity, then tell your doctor. And here's what surprised me most in research. These rhythm shifts often show up before classic symptoms like swelling or coughing. They're not random. They're your body's early Morse code. But when that rhythm falters long enough, the body begins protecting circulation by tightening blood vessels. And that's when another, colder signal begins to appear, literally in your hands and feet. 12. Cold hands and feet, pale skin. You wrap yourself in a sweater, yet your fingers still feel icy. Your toes take longer to warm up, even under blankets. Many older adults blame poor circulation or just thinning skin, but what's really happening runs deeper, straight to how well the heart is sending blood to the far edges of your body. When cardiac output drops, the body makes a survival decision. It redirects blood to protect your vital organs, the brain and heart themselves, by narrowing the tiny vessels in your hands and feet. This process, called peripheral vasoconstriction, helps maintain pressure where it matters most, but it leaves the extremities colder and paler, like the outer rooms of a house losing heat, while the fireplace keeps only the center warm. A 2024 European Heart Journal supplement reported that seniors with persistently cool hands and feet had a 30% higher likelihood of reduced ejection fraction, the heart's pumping strength, compared to those with normal warmth. That small chill, in other words, can be a quiet measurement of circulation efficiency. In my 25 years of clinical work, I've seen patients who said, "My hands have been cold for months, but I thought it was the weather." Once we improved their fluid balance and heart rhythm, warmth returned within weeks. It's one of the simplest, most hopeful signs of recovery. Here's a gentle self-observation. Notice color changes in your fingertips, or if cuts on your legs heal slower. These are small clues that your body's outer tissues are waiting for stronger flow. And when the body's circulation dips this way, balance becomes fragile. The next signal can come suddenly, a wave of dizziness, or even a fainting spell. It's frightening, but it's not random. It's your brain's urgent reminder that the pump needs help. 13. Sudden dizziness or fainting spells. It often comes without warning. You stand up and the room tilts. Or maybe you feel lightheaded climbing stairs, needing to grab a chair before your vision fades. Most seniors call it a touch of vertigo, but sudden dizziness can be one of the body's most urgent heart-related alarms. When the heart can't maintain steady pressure, even a small change in posture can drop blood flow to the brain. It's like a garden hose losing pressure when the pump sputters. Water barely reaches the far end. For the body, that hose is your arterial system, and when the pump weakens, the brain feels it first. A 2024 study published in PMC 101720076 found that seniors experiencing unexplained dizziness or fainting episodes had a threefold increase in undiagnosed arrhythmias, irregular heartbeats disrupting blood delivery. Sometimes the cause isn't dehydration or low sugar, but an electrical misfire that makes the heart hesitate for just one beat too long. In my clinical experience, I've seen these episodes mistaken for balance problems or medication side effects. One of my patients, Carl, fainted while gardening and thought it was heat exhaustion. His EKG later showed rhythm pauses, short, silent breaks between beats. With treatment, his energy returned and the dizzy spells vanished. If you ever feel lightheaded when standing, pause. Sit or lie down until the feeling passes. Track when it happens, morning, after meals, or after taking medicine. That timeline can help your doctor pinpoint the cause. Remember, these dizzy moments aren't random. They're a message from your heart saying, "I need steadier rhythm, stronger flow." And now that we've walked through all 13 early signs, it's time to step back and look at the bigger picture and what these signals mean for your independence, your future, and the simple habits that can keep your heart steady for years to come. When you look back at these 13 signs, fatigue, swelling, breathlessness, the quiet changes in appetite or sleep, they may seem small on their own, but together they form a story your heart has been whispering for months, maybe years, waiting for you to listen. In my 25 years of clinical practice, I've learned that early awareness is everything. The difference between a minor adjustment and a hospital stay often comes down to how quickly we recognize these early shifts. What I tell every patient is simple. Your body remembers how to heal. It just needs you to notice its signals. So take this as an invitation, not a warning. Notice your breathing when you lie down. Step on the scale each morning. Pay attention to that quiet fatigue or new swelling. These small acts of observation can change the course of your health more than any miracle pill. And remember, this isn't medical advice. It's a conversation starter with your doctor. Your healthcare provider knows your history best and can guide you toward tests like NT, Pro, B, NP, or simple daily monitoring that helps separate normal aging from early heart strain. Before you go, I'd love to hear from you. Which of these 13 signs surprised you most? Type it below. Your story might help another senior catch theirs early. If this video brought you clarity, give it a like so we can reach more people who need this message. And subscribe for next week's video, the 5-minute morning routine that strengthens your heart after 60. Take a breath, place your hand over your chest, and feel that steady rhythm. That's your heart reminding you you're still here, still capable, still strong. Listen closely. Your heart's been talking all along.